We're with Dr. John Torous of Beth Israel Deaconess Medical Center and the Harvard Medical School in Boston, talking about smartphone apps for mental health. So, Dr. Torous, for those who might not really know about smartphone apps, tell me a little bit about them. What are they exactly?
So there's been a lot of interest in using smartphones and digital technology to augment mental health services. And the reason there's a great interest in smartphone apps is recently we've seen that these devices are more accessible and affordable to all people from all walks of life. So it used to be the case that people with serious mental illness or any mental illness may have not had access to these technologies. But here and today, most people, I said not all, have access to smartphones, and these are very powerful digital devices. They can record and take in a lot of interesting information, and they can also be useful in treatment by extending our reach and type of services. So looking at a lot of the ways that we diagnose and think about mental illnesses is we kind of recount of what our symptoms have been, how we've been feeling, but we have our phones on us at most times, and it's very easy to take surveys on the phone and record how are we feeling here and now. There's also a lot of new information our phones can pick up about, say, if we say we haven't been very active, we've been staying home, our phones, by virtue of being a phone, know that. The GPS is recording that. So there's a lot of information on surveys that we can take in. There's a lot of information on the phone. And that behavioral information, as well as surveys of symptoms, has the potential to be very useful in mental health.
Okay. Now, you talked about differences in the kind of data that are developed or that are gathered by these apps. And you talk about active data and passive data. What's an example of passive data? What's an example of active data?
Yep, so let's start with active data. So active data would be something that you have to actively engage in. So it'd be like you taking a survey or you giving a voice sample to the app. Passive data is a little bit different. In being a phone, the phone knows where you are. The phone knows who you've called. It may know certainly what websites you visited. So passive data is data that the phone collects in being a phone that could be useful towards your behavioral health, that could give us some signal of what you're doing and how you're doing it.
Okay. Now, I know that there are many of these out there. I mean, is there an estimate on how many of these mental health specific apps there are? And then within that, how many show some feasibility and how many actually demonstrate some sort of efficacy?
You know, that's a terrific question, and no one's actually counting how many mental health apps there are. We think that there's at least over 5,000 mental health apps, or likely could be more. And when I say mental health, focusing specifically on psychiatric conditions, there's many more wellness apps out there, but say there's 5,000 mental health apps. There's very little clinical data showing are these apps useful, are they helpful, are they dangerous. Perhaps about maybe 1% of all those apps out there have some clinical evidence or they've had a clinical study. And if you look at what do those clinical studies tell us, a lot of times they tell us it's feasible. We can collect this very interesting information. Very few to almost none, I could probably count on my fingers, apps actually have shown proven benefit to collect validated information or to give out validated treatment. So I think we have a lot of apps out there. We have very little evidence of what they're doing for good or bad.
Okay, and how has the media done in reporting on these? Do we tend to hype them or we treat it neutrally?
You know, I think a lot of times I said there's cases of both good and bad. I think we've seen a lot of cases where sometimes these apps can get overhyped. I think borrowing from the field of looking at blood testing of Theranos, I think it was a case where the media did a terrific job and helped the scientific community step back and say, hey, there's actually nothing to this blood test company. Let's see what you're actually doing. I think we've certainly seen cases where with Pokemon Go, we've seen perhaps too much excitement or that there's an exciting new technology, augmented reality, that people can use. But what are the health benefits is really unknown. So I think there's a balance of, like anything, sometimes the coverage can be too much, sometimes it can be too little.
Okay. Now you were with the American Psychiatric Association has a task force looking at these. Just briefly describe what's your role, what is it you're trying to accomplish with that?
Yeah, so I'm the chair of the American Psychiatric Task Force that's looking at how do we evaluate these apps. And it's a challenging question how to evaluate health apps because they're always changing. You've probably seen on your phone, they update, they change, sometimes they disappear off the App Store, sometimes they come back. So what we want to introduce is not a static rating that says this app is an A+ or 88 out of 100. We want to introduce a risk-based tool that will help clinicians and patients make the best informed decision. So we'll help people say what's all the information I should be looking at, say what features of the privacy policy are most important, how do I look at the risk data, the benefit data, the ease of use data, and the data sharing, and how do I put that together to make the best informed decision? So we don't know what app is right for you, but we know that we can help give you the right information to make an informed decision.
Okay, I think that's all I need. Thank you very much, sir.
Thank you.